Hey everyone, Lauren here. I'm the medical educator here at the DIS Foundation, where our primary mission is to empower people to save lives by providing healthcare education to underserved areas, both domestic and abroad. And so we'd like to welcome you to our webinar today. And today we're going to actually talk about adult CPR. But before I begin, I'd like to remind you what CPR is. CPR stands for cardiopulmonary resuscitation, and it's a technique that combines chest compressions and rescue breathing in order to deliver oxygen to the body and bring a victim back to consciousness when they're experiencing cardiac arrest. So, to perform CPR, you need to do the following steps. First, you want to ensure that the scene is safe because you don't want to become a victim yourself. Then, you want to assess the victim for responsiveness. Then, you want to call 911 and ask someone to get an AED. Then you want to check and see if the victim's breathing normally and if they have a pulse. And then you perform 30 chest compressions, deliver 2 rescue breaths, and then continue CPR at a ratio of 30 chest compressions to 2 breaths. And then once an AED is brought to scene, you want to use it immediately and then just continue performing CPR and using the AED as it prompts you to until other help arrives. So I'm going to go over the initial assessment. So you want to make sure that the scene's safe because, again, like I said, you don't want to become another victim. Then, in order to check for the victim's responsiveness, you kind of want to just tap, shake them a little bit as if you're trying to wake up a normal person, just because you want to make sure that, they are unconscious and not that they're just not sleeping or something. You also want to keep in mind that the victim may have suffered trauma, so when checking for responsiveness, you do want to be careful because something bad may have happened to them. And then call for help, and if someone else is around you, tell them to call 911 and get an AED, but otherwise do it yourself. So then to perform chest compressions, if the victim is not already, move them so that they're lying on their back and then make sure that they're on a firm surface to allow for effective chest compressions. You want to deliver 30 chest compressions at a rate of 100 to 120 compressions per minute. And if you know the song Staying Alive by Bee Gees, it's basically the same beat. So you can do that in your head to make sure you're performing enough. And then when delivering chest compressions, make sure that you're also compressing the chest at least 2 inches. And then you want to allow for complete chest recoil in between compressions. And then you want to minimize interruptions in chest compressions when giving rescue breaths or when using the AED. And then after chest compressions, you want to deliver 2 rescue breaths. In order to do this, you need to open the airway, and you can do this by either the head tilt chin lift maneuver or the jaw thrust. And then you want to pinch the nose shut and seal your mouth around the victims and blow in. When you blow, you want to deliver it over 1 second, and you want to look for chest rise. If there's no chest rise, you might want to readjust the airway because it might still be blocked, but you want to spend no longer than 10 seconds delivering breaths because compressions are the most important. And also, if you're worried about disease or barrier devices are available, they should be used. So those are pocket masks, bag masks. So here's a video of someone performing CPR. Well, someone, it's me. So once again, I said you want to make sure the scenes are safe, but then you want to assess the victims for responsiveness, look for normal breathing, check the pulse, send someone to get an AED and call 911, and then begin chest compressions. Again, 30 chest compressions. You want to allow for complete chest recoil. You want to go at a rate of 100 to 100 beats per minute. Once you're done doing the 30 chest compressions, you want to deliver 2 rescue breaths. Look for chest rise, as you can see in the video. You only want to deliver 2 breaths. And then